Hello, this is Josh, Dream Body Clinic. Today, we're going to talk about after treatment care for the stem cell back treatment. The back, your spine, is divided into three sections. You've got the cervical spine, which most of us would call our neck. We've got the thoracic spine, which is the middle of the back. And then you have the lumbar spine, which is the lower back. When we do MRIs, in fact, we have to divide the back into those three sections because they're so hyper-specific. To get the right resolution and detail, we have to do it for each one. Same with the treatments. You've got a lot of vertebrae running down the back, and we want to be concentrated into the area. So we always start with the MRI, then we do treatment. We do typically 4 shots of 25 million intramuscularly into the most affected area. We get asked a lot, hey, do you go into the disc? We did that in the past. We've actually seen much better results just going intramuscularly. So that's the route that we go. And it's been working incredibly well. We've seen patients where their disc height is doubled. We've seen facet joint nerve issues heal, herniated discs, stenosis, all kinds of back issues. But you can go watch a video on our back treatment for that. For after treatment care, it's very simple. Once treatment's done, you now want to rest, take it easy. We don't want you going to the gym for the first 2 weeks after. We don't want you doing any heavy lifting, exercise, anything. For the first 2 weeks after treatment, we want you to just take it easy. And that's tough for a lot of us. It's tough for me. I like to work out, I like to be active, but to really get the best results, you don't want to push it too hard. It takes time for cellular regeneration. So 2 weeks, nothing majorly physical. Then after those 2 weeks, we're going to keep taking it easy. We're going to go 4 weeks of light rehab. We've got a really easy protocol you can follow. It's more like light stretching, but this physical rehab matters. We've had patients in the past go too hard, too fast. It's a great example. When we first got started, it's almost around 8 years ago doing back treatments, we had 4 guys, all in their mid-30s, all of them just broy guys. They want to hit the gym. They miss hitting the gym. They were in a lot of nerve pain. All 4 of them had herniated discs. All 4 had sciatica, like nerve pain. And they wanted to fix because they wanted to be back at the gym. They wanted to be active. They all did treatment, but we used to give the option to only do the back injections, and then you could add the IV if you wanted to. And we learned from this because all 4 of them, within like weeks, because their nerve pain was gone, went back to the gym. When I did my lower back, my sciatica, it took 10 days and it was gone. It's never come back. That was over 3 years ago. It works really great and fast for nerve pain, but the tissue, the cartilage, the ligaments, the tendons, the muscle, those take more time to heal. We're typically seeing peak results 3 to 6 months post-treatment. So they got back to the gym too quick because the pain was gone, at least the major pain. I mean, nerve pain is like no other pain. It is unbearable. So they're thinking they're good to go. And unfortunately, all 4 of them pushed it too hard. The 2 that didn't do the IV both hurt themselves, actually worse than they were before. And it was terrible because they could barely afford treatment in the first place. So they spent a lot of money to come down, see what it was like to be fixed, and then end up in a worse position. The cool part was the other 2 guys who did the same treatment, pushed it too hard, they did the IV. The IV goes through the system, has a profound effect on muscle development. There are a lot of muscles in the back. It helps strengthen those muscles. So they were able to compensate. They did not end up hurting themselves again, and they're still to this day doing really great with their backs. So please take it easy. I've had people do it both ways, but after treatment care, you do want to avoid exercising for those 6 weeks. After that, hit the gym, go play your favorite sport. So take it easy. So now if you're post-treatment, there's a few other things you want to do also. You want to avoid anti-inflammatory drugs. Things like ibuprofen, aspirin, prednisone, anything that would confuse where inflammation is not good for treatment because stem cells work by seeking out inflammation. We want to avoid that. So please avoid those type of medications. We give all of our patients some Tramoset, which is Tylenol with tramadol, to help with any pain, though pain is really rare. I mean, these injections are intramuscular. It can feel like maybe a little bruise from the injection site, but never anything major. Every once in a while, someone will feel a bit of pain there because the stem cells work by seeking out inflammation. Well, if your immune system isn't communicating with the brain properly, you might be in more pain than you realize, but your body's almost given up. The immune system isn't telling the body, hey, this area hurts, make it inflamed. so you can send in growth factors, trophic factors, other healing agents to start healing. So when we do the stem cells, they work by sending out extracellular vesicles. These, often called exosomes, send out these signals that light things up in certain cases. They can tell this area, hey, this should be inflamed, and it can make it flare up a little bit, but at the same time, it's sending out others that are going to guide that repair process. So you might have a few days you're a little bit sore, but again, that is super rare. Most people walk out of treatment feeling exactly the same. It's very anticlimactic. They're feeling great, and they're able to get on with their lives. But you'll get the best results if you think of this like a surgery. If you're going to go in and get back surgery, you're going to take 3 to 6 months off. You're going to do a lot of physical rehab therapy. If you can get your own physical therapist to help out, that helps even more. The good part is you're not going to be in that real physical pain you would be from surgery. You're not going to be physically unable to do certain things. You're going to still be able to go out and do whatever you want, but take it easy. Think of it like I just had a major procedure. I just spent a lot of money to get healed. Let's let these things work. Let's get healed. Let's feel good. That's how I recommend taking it. I've personally done it the wrong way. I got my lower back treated from a herniated disc, and the sciatica was gone within 10 days, but the lower back pain took about 3 months to go away. My neck, I did that treatment 1.5 years ago. That took about 5 months to go away. And the neck, you can't totally avoid using your neck. You're looking around, you're doing all that. I didn't push it too hard. It just took longer. But my lower back, I got lucky. I did a trip the day after treatment to Peru and was hiking around in the Andes carrying my son up mountains and ancient sites, and it was a tough back workout. It was really dumb. Luckily, I still healed. I don't recommend you do that. You will be physically capable, but take it easy. Get the most out of treatment, get feeling good, get back out there, and hopefully you never have to do a back treatment again. Your back's good, and you can focus on life. So those are our recommendations. If you have more questions, call us anytime, 833-445-9089. Check out the website, www.dreambody.clinic. I'm Josh, happy to help.